Allergy Center's allergist, immunologist, Dr. Ravi Polasani. Welcome back to the show.
Thank you. Thank you for inviting me.
Good to see you. Well,
Nice to see you too.
Thank you. We've got a number of seasonal issues that seem to be affecting a lot of people, particularly kids. And I had never heard of this before this year. RSV. What is that?
RSV is a respiratory essential virus. It's a type of virus. Just like you have other viruses, there's so many out there. So it causes infections, mainly respiratory tract infection in kids, infants, and older adults.
Why haven't we heard about it before? Is it common now? More common now?
Yeah, it's been there for a long time. Infecting mostly children, infants, usually less than 2 years of age. They get infected with RSV and mostly like cold-like symptoms. But some children, it can get into the airway and then causes asthma symptoms and then get hospitalized too.
Yeah, a parent wonders, oh my gosh, at what point do we go to the hospital? What are the signs that it's become dangerous?
Yeah, especially if they have breathing problems, gasping for air, things like that, they need to go to the hospital, get admitted, and then treated for that. Only 50% children can have symptoms with breathing problems, but most of the symptoms are just a mild cold-like symptoms.
And then what can they do at the hospital? Is it helping with breathing, oxygen?
Yeah, the oxygen breathing treatments definitely would help, and some may need steroids. Even inhaling steroid, treatment can help.
Other than that, so if you don't get seriously ill, if you do get RSV, whether you're a kid or an adult, there isn't any kind of treatment for that right now.
No, there's no specific treatment for that. And you can't even prevent either. No preventive treatment. But some of the kids may develop infection-induced asthma after RSV. Only 30% of kids may develop asthma symptoms. Every time they get cold-like symptoms, the asthma flares up. And then those kids need to be treated right away with rescue inhalers or even controllers, like asthma controllers, like steroids. So that will go on for at least up to 4 to 6 years of age, and they grow out of those symptoms.
Oh, really?
Yes.
So does that cause asthma if a
Yes.
kid gets RSV?
Yeah,
Really?
so not everybody, but 30% of kids develop infection-induced asthma, we call that. But not all the time. Only every time they get cold, they get the asthma symptoms start. Yeah.
But eventually they grow out
They'll
of it.
grow out of that particular asthma, yes.
So we have, similar, and I think everyone's recognized that COVID, the flu, and RSV, you don't really know what you have because they're
Yes.
similar in similar symptoms, right?
That's correct. Yeah, similar symptoms. But flu, flu and COVID, you may get body aches also. Apart from stuffy runny nose, sore throat, cough. And some kids may develop diarrhea, vomiting with the flu. With the COVID, you have a sense of smell and taste, but not with other viral infections.
And that's been one of the symptoms from the start of the pandemic, the
Yes.
taste and smell.
Exactly, with the Delta virus. Omicron, not much, but some patients are still developing, losing.
With RSV being a virus, there's not a vaccine for that, for prevention.
Not yet,
No.
no.
Is it something that they're working on?
Yes.
Yeah.
There, research is ongoing, yes. The phase 1 trials are being done there.
If you do get these symptoms and you're not sure if it's COVID, a flu, or RSV, because there are treatments for COVID and flu, you should get tested. You should find out what you
Oh, yes, you should find out. Not only to find out to prevent, infecting other people, so yes.
Well, when the weather warms up, these seasonal viruses will start to taper off. And that's an annual thing, once we get outdoors.
Yes. Yeah, the pollen starts middle of April or beginning of April, tree pollen mainly, and then some seasonal mold out there, and people develop symptoms inhaling those.
I know indoor air quality is a concern for a lot of people, and I have friends that they go to Arizona because of winter. And I was always surprised because I never thought there's anything in the air in the winter, and they said no, it's indoors, indoor air quality, indoor, it's not good.
Yes. So indoor allergens, especially the mold, in the basements or bathrooms, wet areas, there's mold grows there, and also dust mites. Every house has dust mite. There are 2 million dust mites in each bed, on the carpet, and also pets. These are the common allergens. Indoor allergens cause symptoms in the winter because it's a closed, enclosed spaces we live in, and more time you're spending inside the house during the winter, more exposure, more symptoms.
What are the remedies? Open the windows, go outside, get the house completely deep cleaned, all of the above?
Yes, see, vacuuming the house twice a week helps, and washing the bed sheets and pillow covers definitely would help, and enclosing a pillow and mattress in a dust mite free covers would help for the dust mites. Keeping humidity down less than 50%. If somebody's using the humidifier, that would help. And if the pets are there, if they cannot get rid of the pet, they shouldn't be in a bedroom at least. Trying the air purifier helps. And the mold areas should be cleaned.
Is there such a thing as a non-allergic pet?
There's no such thing. Some of the pets may have less allergen compared to other pets, long-haired pets, Yes, but the pets you're exposed often, your symptoms are less because your immune system is kind of trying to get desensitized, but not enough to control all the symptoms. They do have some symptoms, but they get used to them, like a mild congestion, maybe a little drainage. As opposed to new pets, the symptoms are more pronounced, like itchy and watery eyes, sneezing, shortness of breath, wheezing. That happens to the new pets than your own pet.
I know people that walk into a room if there's a cat there. Suddenly they can't.
Yes.
They know the cat's there before they even see it.
Oh yeah, that happens to my wife. When she walks in the house, she can tell right away. She starts sneezing.
And you just got to stay. There's nothing you can do except just not be exposed to those pets.
Yes, especially petting a cat or a dog, you have to wash your hands right away. And then if you have a bad pet allergy, if you're going to somebody's house for a dinner or something, make sure they don't vacuum the house 8 hours prior, because pet dander floats in the air for 8 hours before it settles down. As opposed to dust might come up and goes down quick. So the air purifiers won't help, So
it's floating in the air all the time.
All the time.
And those people that are meticulous about keeping their house clean, you can't get rid of dust mites. It's just their part.
Right. Even if you do thorough cleaning within 2 weeks, it'll come back. Even if you buy new bedding, within 2 months they come back. They're there. So yeah, you cannot. Because dust mites eat our skin flakes. That's how they survive. They need food, so we are providing them food. That's why they're there on the bed and carpet.
They're a necessary part of the circle of life.
Mm-hmm. Yes, exactly.
Good thing you can't see them.
Right. I know. They're ugly-looking bugs and fuzzy and under a microscope, electron microscope. You can
I don't
see.
even want to see them under a microscope. I don't want to know what they look like.
Right. Right.
All right,
That
food
will be-
allergies. Now that can be something that could affect somebody anytime, and someone get a food allergy at any point in life.
Yes. It's more common in kids, but yet, yes, it can happen any time. But not first time though. First time your body never experienced. So first time when you ingest, it takes, if you're allergy genes, let's say, then your immune system makes antibodies. It takes at least 3 to 4 weeks to make antibodies. Then a person may react second time, another person may take 100 exposures, but not the first time.
There have been, I think, so many conflicting instructions on what to give a child and at what point, at what age. We've heard, oh, you don't give any peanut products to any child until they're past the age of 2. No honey. Honey cannot, baby cannot have honey. What's your recommendation in terms of food introduction to prevent a food from becoming an allergen to a child?
Yeah, that's a problem in the Western world because we're introducing food later on in the life, like after 1 year of age. But the Israeli study showed that they introduced peanut product early on, less than 1 year of age, and then tenfold less allergy to peanut compared to the U.S. and U.K. children. So introducing early on definitely reduce the food allergy.
So we've been doing it wrong.
Yes.
And that's caused
that's
more.
recommended now to start on early. Yes.
And anyone my age will just be confounded that on planes, for example, oh, we can't serve peanuts on this plane, there's too many people allergic. But that seems like a relatively new response to is it that there are more, and it sounds like, yes, there are more people allergic to peanuts than there were 30, 40 years ago.
40 years, yes, that's true.
What other, so peanuts, what are some of the other common foods that people are allergic to?
Yeah, especially in children, milk, soy, egg, wheat, but they grow out of those allergies by adolescent, And now the adults are usually, even children too, other nuts like tree nuts and seafood, fish, and now the new ones are sesame seeds.
Oh, really?
Yes. Also buckwheat, those are the allergens. Those continue into adult life. Other than milk, wheat, soy, egg, we grow out of those allergies.
How does someone know? So they stop dairy or they stop wheat and they feel that this is the life. For my rest of my life, I'm not going to be able to have this food. But they could possibly grow out of that allergy. Do you test people on a regular basis to see if their allergies change?
Yes, we do that. Yeah. The peanut allergy actually, up until 5-6 years ago, we thought nobody could outgrow. That's not true anymore. 20% of kids grow out of peanut allergy within 4 years of age, and tree nut allergy only 10% can grow out of it. And there's a test. Yes, every couple of years we can do the test, peanut testing, and then we do oral challenge. That's the gold standard. When the test is negative, we do oral challenge, and then if they tolerate it, they can eat. Now, some kids may need a desensitization, peanut desensitization approved by FDA now. There are some capsules out there, and also peanut protein powder that we do that. So introducing a very tiny bit every day so that only few allergy cells break open and then you don't have a pronounced reaction. So you go up gradually. That takes months and months, at least 6 months to a year. Then they can tolerate at least 6 to 7 peanuts, 600 milligrams of peanut they can tolerate.
Wow, that's a lot of work to be able to enjoy a couple of peanuts.
Yes.
But I would imagine it's just for safety.
Yeah, safety issue. They don't need to worry about going to parties or accident ingestion, having a systemic anaphylactic reaction. You can avoid that.
Well, I know you see a lot of patients and help people with all kinds of issues, viruses, allergies, asthma, and you're welcoming patients, and all they have to do is give your office a call.
Thank you very much.
Thanks for coming in. Good to see you.
Thank you.
From the Asthma Allergy Center, Dr. Ravi Polasani. Coming up, we've got more